use the same scar and go through the same surgery that was made prior. At the same time, with the minimally invasive technique, she did very well after surgery, and she went home the next day.
It's good to hear.
Thank you.
Are there research centers that develop these new techniques?
There are, and these research centers, you might be surprised to find out, are not typically big academic centers. Mm-hmm. They can be, but they usually are more focused around where companies who have focused on design and development of new technique and technologies have placed their time and investment into developing these new things.
All right. Our next email question asks, are there special tools that you use to do minimally invasive surgery? And that is from Bill in Sarasota.
Yes, we do have special tools or instruments to help us with minimally invasive surgeries. A lot of that, like Dr. Sweeney says, are platforms that we use, from small tubes that measure no more than 1 inch in diameter. We also use special microscopes and x-rays that would allow for us to better visualize the surgery and have better visualization of the anatomy during surgery.
Dr. Sweeney, have you designed spinal procedures, implants, or instruments?
I have. That's one of the things that I like to do, and so I do a lot of it. And to get a little bit and cross that over with your last question, if you're working through a small tube that may be that long, instead of making an incision about 6 inches wide, the instruments can't be big and bulky. Mm-hmm. And so it's very obvious that they need to be long and slender, but it may not always be easy to achieve the surgical goals with long, slender tools. So that you have to make special designs to do that. Interestingly enough, we sometimes fix spines with screws and rods, and if you were to hold them out at arm's length, you might say that they look the same, but they actually function differently, and some are just better able to be passed through very small spaces. I sometimes say doing spine surgery is like building a ship inside of a bottle, building a large structure, because what we do is quite large, but of course that's just a trick. That's quite easy.
All right, we're going to go ahead and take one more email question. Are minimally invasive surgery and laser procedures covered by insurance? And that is from Janice in Venice.
Janice, I get this question all the time, and absolutely. And the reason is because using a laser is not the operation. The operations that we might need to do, whether they're percutaneous, meaning through the skin as an outpatient, or whether we use a tube through the skin with a laser or not, those are all covered by insurance. And so it's the same operation that in the past insurance companies and Medicare have all covered, and we may just use the laser as a tool. So we work at Doctors Hospital, and our facility all participate with most insurance companies and certainly Medicare. And so laser procedures are covered by insurance.
We should let people know, of course, that they can find out more about you by going to doctorsofsarasota.com. Again, the website for Doctors Hospital of Sarasota is doctorsofsarasota.com. And I think one question that people really want to know is, over the next 5 years, what advances do we see in spinal surgery? Will there be cures and treatments? What kind of advances will there be?
Ten, I don't know what you think, but I think one of the areas is motion-sparing technology. People have realized that a certain percentage, if you look at large numbers, 3 out of 10 people, if they have a fusion, they might need to have another operation within about 10 years. And so there's a big push to develop more of these type of things. Mm-hmm. This is a lumbar disc replacement, which instead of doing a fusion, you can place in the spine to maintain motion. And this is a similar one that's also, of course, cleared by the FDA that we can place in the neck to maintain cervical motion. There are at least 20 other cervical discs that are being investigated now in trials, some of which have distinct advantage to this particular one, and may or may not, but the studies will prove out. We'll have some of those results over the next 5 years. We also are looking at, and we're participating in one study, to be able to place the lumbar disc through a very small tubular access incision. That's an ongoing study which I'm very interested in, obviously, for lots of reasons. But the other main area, I think, is biologics. And so what I mean by biologics is that we are using proteins, which are growth hormones. And growth hormones are short sequences of proteins in our bodies that tell us to do things, like obviously the growth hormone, so you grow. But there are other ones that help you repair tissues, There's other ones that stimulate growth of certain tissues like bone or cartilage. And so there are studies underway in which we are, not us personally, but we are watching, that are injecting stem cells and growth factors, combinations of different growth factors, into areas like early degenerative discs that are causing back pain. And so that's probably not 5 years away, but that's most likely 10 to 15 years away, where when people come in early on, they can have an injection of one of these and hopefully prevent ever having surgery by actually regenerating the tissue, rather than us really, at this point, we need to fix what's gone on untreated for quite some period of time. That reminds me, if I might, one of the messages I'd like to get across to people is that when you have a problem, it's best to be treated early on. The earlier you get treatment for back or leg or neck pain, the more options we have, and the most likely your options are, number one, going to be non-operative, and number two, be minimally invasive rather than need something big to be done.
All right, well, is there one last thing that you'd like to say before we end our show, Dr. Lee?
Yeah, I agree with Dr. Sweeney in that the earlier that you get in and be seen, there's more options that can be seen, that can be available for you, whether it's surgical or non-surgical. And just so when you come see us, it really doesn't mean that you need surgery.
All right, all right. We want to thank both doctors for all the great information on spines and how to treat them, and we want to thank you for being on the show, Local Doctors on Call, and remember to stay tuned next week because it's your health.